Hi there, and thank you for joining this presentation. My name is Dr. Adam Chaifetz, and I am a specialty trained chiropractic physician in the field of neurology. Today, I want to educate those who live with chronic pain in the neck and the lower back areas, as well as headaches that are related to the neck. And finally, those who suffer with chronic soft tissue pain because of myofascial pain syndrome or fibromyalgia. Chiropractic care is a reasonable alternative to opioid medications for the treatment and management of many spinal-related chronic pain conditions, as well as the soft tissue-related problems. I'm going to discuss some of the causes of chronic spinal pain and complementary therapies, along with chiropractic care that can assist your team in the medical management of your condition. This program is brought to you by the AI-PAMI project. This is a project that addresses non-opioid pain management in adults that are the age of 50 or older who reside in the Northeast Florida area. The goal of this project is the advancement of education and patient care through both provider and patient workshops that are focused on integrative pain management. Funding is provided for this project by the Florida Blue Foundation and the Florida Medical Malpractice Joint Underwriting Association. You can visit this at pami.emergency.med.jax.ufl.edu, or you can contact them at the number on the screen. A little bit about myself. I was trained as a chiropractic physician. I went to school at Life University. My undergraduate degree was from the University of Massachusetts, and my specialty training in neurology was from Northwestern Health Science University. I also have additional specialty training as an MS certified specialist. I began my clinical practice here in Jacksonville in November of 1987, and I was the first director of an area chiropractic rehabilitation center. Since 2008, I have served as the program clinical coordinator for the Comprehensive Multiple Sclerosis Center here in the Department of Neurology at the University of Florida, Jacksonville. I'm honored to be asked to do this presentation so that patients understand that chiropractic can be a reasonable non-opioid alternative to chronic pain. When patients go to see chiropractic doctors with neck-related symptoms, they generally present with a myriad of symptoms consisting of usually pain and inability to move. Sometimes the potential causes of this can be due to a trauma, a motor vehicle accident, for instance, a sports injury, or they could have done something a lot less traumatic by just simply sleeping wrong. There are remote neurologic conditions called torticollis, which is a very severe and significant presentation of spasm in the neck area. Cervicogenic headaches are neck-related headaches to where we know that there's an association between the neck and the person's headache. So there is a classification of cervicogenic headache that has been classified by the International Headache Society. In medicine, there are variable methods for treating this, and these include medications, injections into the soft tissue in the neck, and then also physical therapy is also offered, which centers on posture and exercises related to neck instability. If we look at the presentation of a normal neck on an X-ray, you will see here that this is what we would consider to be a normal lateral cervical X-ray. And you can see here that all the vertebrae are numbered. C is in cervical 1 through 7. If you look at this X-ray, the back of the head is here and the nose would be here. So this curve in the neck in a normal fashion is curving towards the front or the nose on a person. Now, this is important to understand because when we get a look at what abnormal looks like, you will be able to see that there is a significant difference in the structure. Between each of these vertebrae, you have soft tissue disc spacing, and each of these vertebrae has a very nice amount of spacing in between each of the vertebral bodies. The curve on this person is very nice, arcing towards the front or the nose of the person. When we look at the neck area, we're looking for the curve or the lordotic feature. We're looking for the disc spacing, and we're also looking at the overall alignment. If we get a look here at a comparison between the normal and the abnormal view, what we'll be able to see is that the cervical curve can create excessive postural pressure by putting abnormal forces to the muscle and the fascia. So if you look at the normal curve here versus the abnormal curve here, you will see that the curve is going in the forward direction in this slide and actually is going in the backward direction in this slide. This disrelationship of the vertebrae causes the abnormal and early degeneration of the spinal joint. So if you look at this disc right here, what you see is an abnormally early degenerative sign of a disc space relative to this one here or this one here. And the pain that a person gets when they develop this arthritic change in the neck is usually stiffness in the joints and tightness or spasm in the muscle to accompany these changes that happen in the spine itself. So why do patients see a doctor of chiropractic? Well, they're not interested in medication management. They may have a fear of surgery. Many are referred by a friend or a family member. Maybe they have been in an automobile accident, and some medical offices do not participate in these types of cases. You may have gotten a referral from your primary medical doctor or osteopathic doctor, or even a specialist. And a person could be just tired of dealing with pain and headaches and have known that chiropractic care is a reasonable alternative. And many patients that we see have not received results from traditional medical management. They may be under traditional management, but possibly they're seeking additional consultation and relief. If we look at lower back pain, the reasons are very similar that patients would see a doctor of chiropractic for lower back problems. And those include trauma, injury, or the person could just be out of shape physically and do something very minor, such as bend over to lift a box, bend over to pick up a suitcase. And so we see a lot of back pain cases that are due to simple things like people basically being out of shape. Chiropractic care for back pain has been verified. The American College of Physicians and the American Pain Society, the guidelines for the conservative treatment of lower back pain, recommends spinal manipulation. The impact of care on the use of prescription opioids in patients with spinal pain, there was an American Academy of Pain Management study that was done. And in this study, patients over a 6-year period who had spinal pain had a 50% reduction in risk for the prescription of opioids when managing their condition. So there is research that does justify and verify lower back pain management through chiropractic care. In 2018, there was a published study by the Journal of the American Medical Association, and it was the latest to weigh in about the pros and cons of chiropractic care in treating lower back pain. So they took a reasonably decent amount of people, 750 active duty military, who complained of back pain. Half were randomly assigned to receive usual care, which would include medications, self-care, physical therapy, while the other half received usual care plus up to 12 chiropractic treatments. After 6 weeks of treatment, or 2 visits per week for 6 weeks, those assigned to receive chiropractic care reported less pain, less disability and improvement of mobility, higher satisfaction, and basically they needed less pain medication. When we look at causes of back pain, one very common cause that we see is a lumbar disc condition. If you look at the MRI image on the left, this is an image of the entire spine where the person is laying on a flat, hard table. The only problem with this type of imaging is that it is not weight bearing, and so the actual pressure of gravity and the person's weight through the spine and onto the weak disc is not adequately displayed. But in some cases, you can plainly see, like in this case, where there is a protrusion of the disc backward, and it is actually intruding upon the spinal canal and the spinal cord or spinal nerve roots. When we look at a lumbar disc, I tell my patients the best way to describe it is like a jelly donut. The blue fibers are circular, would make up the donut. The nucleus pulposus is a gel type substance that's in the middle of the disc. When these ligament fibers weaken over the years due to degeneration and injury, you can get a weakness in that disc area where the nucleus compound migrates to the back of the disc and actually starts to put inflammatory pressure on the nerve root. So there's a variation in disc problems where you simply have a discitis, where a disc is inflamed and irritated. You have a protruding disc where you have a weakness in the disc, where part of the disc is actually protruding out, kind of like a weakness in an old inner tube tire that we used to see many years ago. And finally, a herniation or a prolapse of a disc is much more severe, because what you have is the breaking of the ligamentous contents, and the interior contents going out of the inside of the jelly donut and literally free floating into the spinal canal, which can cause a lot of problems neurologically. Just like in the neck area, if we compare the normal on the left here to the abnormal on the right, we can appreciate that the curve in the low back or the lumbar spine is also very similar to the curve in the neck in that it goes in the forward direction. These blocks are the vertebrae in the spine, and the black spaces represent where the disc space would be. Now, in this picture on the left, it looks completely normal because the disc spacing is very well preserved. If you compare this X-ray to this one here, what you will see is the starting degeneration at the L4, L5 level, and even here at the L5, S1 level. The black arrow represents a normal disc spacing, whereas the white arrow represents a compromised or narrow disc spacing. Why is that important? It's important because when you lose the disc space, we start to have a smaller hole where the spinal nerves can exit from. So when we look at this hole in relationship to the ones above it, we have a potential for what is called stenosis or narrowing at this nerve root here. Spondylolisthesis is a condition where the vertebrae in the lower lumbar spine are actually slipping and sliding forward on the base of the tailbone that's called the sacrum. This happens when the joints at the back of the spine literally break or separate, and it causes the forward translation or sliding of the vertebrae, which can stretch the nerve roots and cause pain, weakness in the legs, and inability to walk, if considerable. In severe cases, these are surgical, and the way that they determine surgery is going to be based on the neurological symptoms as well as the grade of sliding or slippage that the vertebrae is going through. This is an example of a patient who had an injury. He fell approximately 20 feet out of a tree, landed on his spine, and fractured his lower thoracic, upper lumbar spine area. He had neurosurgery done and had a spinal fusion done with a fixation device, which literally fixed these segments together. Years later, he developed pain in his lumbar spine and his lower back, but the hardware that was implanted in him actually can complicate some forms of manipulation and manipulative therapy. This patient was referred to me by his neurosurgeon, and we did some conservative soft tissue therapy on him and was able to resolve his problem along with home exercise and PRN chiropractic care. The Piriformis Syndrome is a controversial but known form of lower back causes where we have leg pain, buttock pain, and numbness in the lower extremity. The piriformis muscle is a unique muscle that's found deep in the buttocks and allows the lateral rotation of the hip. When this muscle goes into spasm, it can produce pressure on the sciatic nerve, which can in turn cause the symptoms of sciatica. Piriformis syndrome, in my experience, is very common in athletes, but is noted in literature to be more common in women. If we look at the nerves like the piriformis and the biceps femoris, these muscles surround the pathway of the sciatic nerve, leaving the gluteal muscles and going down the back of the lower extremity or the leg. Soft tissue myofascial release and soft tissue related positional therapies are very helpful in alleviating sciatica when a person has a piriformis syndrome. In addition to these hands-on manual therapy techniques, there are also specific exercises that are given in order for the patient to improve. Myofascial pain syndrome is a soft tissue condition where a person has localized pain with trigger points. There are infrequent symptoms that can accompany this, but in general, the most prevalent symptoms are going to be localized pain with what we can palpate in the musculature as active trigger points. In addition to these soft tissue signs, we can see additional things like muscle stiffness and headaches as a result of this muscular tightness. Myofascial pain syndrome should not be confused with fibromyalgia. Fibromyalgia is a more chronic condition that causes pain and tenderness diffusely throughout the body and not just in one or a few particular areas. It is widespread and has a number of diagnostic tender points which must be present in order for there to be an accurate diagnosis. This diagram accurately displays the tender points that are on the front and the back of a person who suffers from the soft tissue problem called fibromyalgia. Here is a table which shows you the differences between myofascial pain syndrome and fibromyalgia. So if we look at myofascial pain syndrome, for instance, if a person has a car accident and their myofascial pain syndrome is in the neck and the upper back and trapezius, it's not likely to cause things like headache, irritable bowel syndromes, or a sensation of swelling. It can cause additional neurologic symptoms depending on what's involved, but in general, it's not considered to be a diffuse condition. If we look at fibromyalgia, we see a very diffuse presentation of approximately over 10 tender points, which are both on the front and the back of the person. They have a myriad of symptoms that usually accompanies it, which includes things like fatigue, poor sleep, headaches, and GI or irritable bowel symptoms. The therapies that are utilized by chiropractic physicians have been around for well over 100 years. Chiropractors treat primarily spinal conditions, but do treat orthopedic conditions such as shoulder, hip, and knee. We do use a number of physiotherapy modalities such as electric muscle stimulation, ultrasound, laser therapy, soft tissue therapies such as neuromuscular massage and myofascial release. We do rehabilitation strengthening exercises, and then we also perform various manipulative therapies which have indications for different types of spinal conditions. Neuromuscular massage and myofascial release is a specialized training of soft tissue therapy that chiropractic physicians, physical therapists, massage therapists, physiotherapists, and anybody who works in the field of doing manual therapy with soft tissue, myofascial release and neuromuscular massage is some of the most effective soft tissue techniques to treat both chronic and acute related problems. Manipulation or manual therapy, there are various techniques utilized. The picture on the left here, this is a chiropractic doctor who is doing a lower back or lumbar spine adjustment. The picture on the right here, this is a physical therapist who is performing a lumbar spine mobilization. Cervical manipulation or manual therapy is also done by a variable field of professionals. Once again, on the left here, we have a doctor of chiropractic performing a cervical manual therapy or manipulation adjustment on a person who's a relatively healthy person. In the middle here, this appears to be a massage therapist doing a very subtle form of therapy called craniosacral therapy. And then on the right here, we have a doctor of osteopathic medicine performing OMT or osteopathic manipulative therapy on the neck of a person who is laying in the face down position. So you can see that manipulation in general or manual therapy is utilized by a various amount of professionals in the healthcare field. We also utilize electrotherapy, and low voltage electric muscle stimulation is very advantageous because what it can do is it can prepare the person for deep tissue manual therapy by fatiguing the muscles and actually relaxing them. Electric muscle stimulation is a safe and effective therapy that a patient can use at home. It can be used in acute problems. It can be used in subacute problems, which is a healing issue, or it can be used in chronic stages of low back pain, which are due to chronic back spasm. So it's an excellent way to treat back spasm without muscle relaxants or opioids. Ultrasound is also an adjunctive modality that we use more for acute inflammation. It also can be used for patients who have chronic myofascial pain syndrome. It can optimally prepare the patient's fascia and soft tissue for myofascial stretch techniques and passive release techniques of the spine. Microcurrent is targeting electrical current to trigger points which can help reduce both the pain in the area and the muscular spasm. Microcurrent is non-invasive and not painful and can be utilized in both myofascial trigger points and even acupuncture points. As chiropractic physicians, we have been utilizing exercise and rehabilitation for almost a century. We know that it is important for patients to have some input into their care, and their responsibility for exercise is helpful in patients maintaining chronic pain levels. Some recommendations from the Florida Department of Health for alternatives to opioid therapies. There are a number of therapies that the Florida Department of Health is recognizing to be helpful for patients who suffer from chronic pain. Keeping in mind that opioid presence and addiction is a very significant problem in the state of Florida, they are trying to help patients understand some of the therapies that may be available to them. So if we look very simply at some of the therapies that are listed, acupuncture is an extremely effective treatment regime that is best administered by doctors of Oriental medicine and trained acupuncture doctors. Chiropractic care is best done by chiropractic physicians, and our hands-on approach includes mechanical, electrical, and natural methods, including nutrition. So we can help with pain management, but we also are stationed in terms of our licensure as primary healthcare providers. Osteopathic manipulative treatment is an extremely effective, like chiropractic, manual therapy treatment. Osteopathic manipulation done by DOs or osteopaths is completely effective, and many of them have significant training in this regard. Massage therapists do not have as an extensive of education as chiropractic physicians and osteopathic physicians, but they play a key role in physical medicine in delivering manual therapies directed at the soft tissue and connective tissue, which is an extremely important part of rehabilitation and also management of chronic pain problems. And then lastly, transcutaneous electric nerve stimulation, or TENS, is the application of electrical current through the electrodes on the skin. And what this basically does is this is how we use neurology and the theories of the gate pain theory to try to trick the brain into thinking that there's not a pain presence. So what we've done is we stimulate the cutaneous nerve endings, which allows the area in the brain called the thalamus to focus on other things and hopefully decrease the person's perception of pain. All of these are non-opioid alternatives to treatment. And unfortunately, many or some of them may or may not be included in your insurance plan. But don't give up and look and seek, because many of these are included in insurance plans, and patients would be surprised that they may have some benefits that they were not aware of. So in conclusion, I want to talk a little bit about chiropractic care for painful conditions. Chiropractic doctors are licensed under Chapter 460, which is the Florida Board of Health, and we serve as primary care doctors, and we're trained in the diagnosis and management of many health conditions. We do not use invasive techniques like surgery or injections, and we do not prescribe medications. We believe and rely wholly on wellness techniques to prevent health conditions. But when we do treat a patient with a healthcare condition or a problem, our knowledge of things like nutrition and exercise, rehabilitation, and manual therapy allows a treatment paradigm by which patients have direct access to chiropractic doctors and really do not need to be referred by any other providers if they don't choose to. Many or most patients can be seen the same day or within a few days, opposed to weeks in many medical specialties. And I do find it unfortunate that more medical and osteopathic physicians and mid-level providers like ARNPs and PAs do not refer a little bit more to chiropractic care. Chiropractors have more training and experience in the field of manual therapy than probably anybody who does these disciplines. And there are many physical therapy programs that do have residencies and fellowships for learning manual therapy. So they do recognize that manual therapy can and will be an important part of a patient's improvement in their condition, as well as maintaining them in a restorative, functional state once their treatment ends. Reasons to consider care. Maybe you've tried traditional medical care and the pain hasn't resolved. You could have been in a motor vehicle accident and can't find an office that treats patients in accidents. You might have a non-conventional approach to healthcare. You're more of a wellness mindset. And before going to medications such as pain meds or opioids, you'd like to look at some alternative therapies or complementary therapies. You might have an acute onset of a condition that you thought was chronic, but actually got worse because you did something, and you need to be seen almost immediately. The good thing to know is that chiropractic care does satisfy most insurances for coverage. So many patients will find that they will be able to get some, if not all, of their treatment covered. And the important thing to understand is that patients can go to a chiropractic physician without the referral of an MD or a DO in most cases. We do work closely with physical therapists and medical and osteopathic physicians, as well as a whole myriad of medical specialists when we treat patients in a chiropractic office. And finally, chronic pain is a very serious threat to a quality of life that a person has. It can cause depression, irritability, and can be very difficult to accept because of the constant nature of it. Patients who have chronic pain also may have many other conditions at the same time, such as depression, gastrointestinal or GI complaints, and inability to sleep. Pain management is best achieved by a compilation or a team of professionals that understands that, that everybody can contribute something to the patient's pain management experience. And all patients should be encouraged to participate by doing things on their own, such as exercising and utilizing some of the techniques taught. So compliance can be an issue, as it is with many medical problems. So what we see is that if the plan only depends on the patient doing what they're supposed to do, in some cases it can fail. So the best management tool is to be guided by another individual, whether that's directly or indirectly. And this is where you want to use your team of pain management, physical therapists, chiropractic physicians, acupuncture, massage people. Everybody knows what everybody's doing. And then lastly, my experience is not only as a medical professional of 33 years treating patients with chronic pain in their neck and back, but I've also suffered for 24 years living with chronic pain due to a permanent injury, which basically ended my ability to practice full time. So As much as anyone, I greatly understand the nature of chronic pain and ways to deal with it because I have to live with it. I want to thank you all for taking the time to listen to this presentation. And at the end of this, you will see that there are many references which were used to talk about the chiropractic management of your chronic pain. Thank you for listening and have a great day.